we're really pleased to welcome Simon Stevens here to give our annual Teddy Chester lecture. And it's an apposite time because Manchester is, of course, the place where health and social care is being devolved to a local level in a deal that brings £6 billion of health and social care spending under the control of the Greater Manchester area, and that's a really important experiment in the future design of health and social care services. Everyone seems to agree that health and social care integration is a good thing. You once described bringing the two together as combining two leaky buckets. What are the barriers, the real barriers to health and social care integration? How far can it progress in today's environment?
Well, I think we've got to do two things, and we can't pretend that just doing one solves the other. The first thing we've got to do is ensure that we have a properly funded social care system in just the same way as we need a properly funded NHS. And so yes, I did say that you can't solve the health and social care funding problems just by putting together two leaky buckets and thinking you've got a watertight care system as a result. So we do need a national conversation about how to ensure that social care services are properly available at times of need. But even with the funding, we've got to make sure that the way care is being provided is actually properly joined up at the point of delivery.
The financial settlement for the NHS over the last 5 years has been essentially flat. In fact, the amount of money in real terms per patient has been declining because the population is growing. And the settlement over the next 5 years is equally flat. And if the government sticks to that, it will be the longest period of flat funding for the NHS in its history. And that contrasts with medical inflation, which generally runs at 3 or 4% a year. So the pressure is on to be ever more efficient. You've urged NHS leaders to think like a patient and act like a taxpayer, but isn't there a conflict inevitably between those, between patients' demand for services and taxpayers' willingness or ability to pay for them? And is that even more acute now than it has been in the past?
At some point in our lives, we will all be patients, and most of us are taxpayers. So it's a question of how to both ensure that the services we provide are genuinely responsive and high quality for patients, but also having the conversation with the British people about the resourcing that a tax-funded health service will need. And I detect no decrease in the willingness of the British people to support a tax-funded health service. But in order to pursue that, we've got to continue to show that the health service is an investable proposition, providing high-quality care for people at the time they need it.
Manchester has the ambition both to make the inequalities in health between Manchester and the rest of England, because Manchester is an unhealthy area, reduce, and also to reduce inequalities within Manchester. So that there's an agenda for devolution that's not just about service reconfiguration, but is also about better health promotion and disease prevention, and also about reconfiguring the way patients access services to make them use services more effectively and to seek less urgent care, but instead get a planned preventive care in the community.
For Greater Manchester as a whole, obviously we're in the early stages of a big move to combine £5 billion worth of NHS expenditure with £1 billion worth of social care expenditure. So I think, yes, we've got to sort the funding out on both sides of the equation, but even if you do that, you've still got to join up the way services themselves are provided.